Brouwer has done a study looking into the cost effectiveness of hyperbaric oxygen therapy in diabetic foot ulcers. This is an important study, and it's something to look at. The basic question is, does adding more hyperbaric oxygen therapy lead to better outcomes? And then not only that, what is the economic angle to it? So they have all the different types of diabetic ulcers, 1 through 4, from the smallest to the worst. The outcome is they find there is no added economic burden from using hyperbaric oxygen therapy in these populations. Now, there's a little bit of controversial findings that need to be explained. When he found type 2 ulcers or grade 2 ulcers that are not that bad, they found that there was no added benefit from hyperbaric oxygen therapy versus the worst ulcers, which tend to improve. That is contradictory to standard hyperbaric teaching, and this is something worth discussing. Typically, a surgeon will send us a patient with hyperbaric at the very end when nothing else is working, and they hang on to the patient and just keep working with them if they're otherwise okay. Hyperbaric oxygen therapy works through all 4 stages of these kind of ulcers, meaning from the beginning to the end. The earlier you give it, the better outcomes you expect, but it's not that the wound heals and goes away, so the wound goes and doesn't come back. Why? Because you're fixing the underlying issue where the blood vessels are just not okay. You make those better, and then they shouldn't have further ulceration, meaning they get to keep their leg. And I'm not sure they've actually looked into those kind of outcomes. They may have just looked at wound healing alone. And if that's the case, this is why they got that outcome result. But either way, the bottom line is, using hyperbaric oxygen therapy is not an added cost in the long run compared to standard care, and does provide better quality of life.